Dr. Dyson. Now we're going to have some questions that you get an opportunity to ask questions for our speakers, but I'm going to introduce our second speaker, Dr. Ahmed Ali, who's a hematology oncologist from Howard University, but he comes to us from the Khartoum, Sudan, and he did his training at Howard. And I just want to say before Dr. Ali comes up, he has conducted numerous cancer research studies and given lectures on the topic, and he's really focused on immunology and integrated cancer treatments and individualizing treatment, and it's really important because we've moved into targeted therapy, and of course as an oncologist we always practice targeted therapy, but that's really important. And I think he will give us some information about multiple myeloma. If not, I mean, some people are still wondering, what is that disease? It's a blood disease that impacts your bones, but I won't take away from Dr. Ali's talk. Thank you.
All right, thank you everybody for having me today. I work at Howard, American Oncologist, and I deal with many patients with multiple myeloma. In my clinic, actually, when the patient comes to me, usually they have established the diagnosis of multiple myeloma. So multiple myeloma is blood cancer, as we all know, and it's like about 20% of all blood cancer. However, it's more, we see more cases in African American. There's 3 times risk of having the cancer in African American compared to Caucasian patients. So I'm just going to go back and talk about the nature of the disease itself. So as we know, all blood cells come from a bone marrow, which is located inside the bone itself. This is what I tell my patient, basically is a blood factory. Produce all type of cells, white cells, red cells, and white cells is the defense mechanism against all bacteria, germs, and those white cells usually are different type of cells. So we have one of those cells called plasma cell. Plasma cell is very important for our immune health. It's responsible for production of antibodies that goes and fight against germs and bacteria. So those antibodies, we call it protein, because basically those are protein that's very helpful to the body, recognize bad foreign bodies and fight it. In multiple myeloma, something goes wrong in the bone marrow and it starts to produce bad plasma cells. So those plasma cells, instead of producing a good protein that fights and helps us surviving, it starts to produce a bad protein. That protein usually do more harm to the body. Especially it goes to the bones and start to chew in the bones. It affects the bone marrow itself, the factory. Those bad cells start to expand and compete with the normal cells. Also, this bad protein can circulate and goes to the kidney and cause some kidney damage. Hence, when we see patients with multiple myeloma, for the most part, we see these symptoms. The most common symptoms we see in patients is anemia. So basically those patients, they have anemia symptoms, being tired all the time, get short of breath with minimum exertion. When they start walking down the street, they get short of breath. They feel tired all day, sometimes dizzy, feel of heart racing. This is our general symptoms of anemia. And those patients, usually they go to their primary care physician, complain on all these symptoms. So the primary care physician, they run blood tests on them and they find the blood count to be low. Then they have to have like high index of suspicion. Especially, multiple myeloma usually occurs later in life. Most of patient age is around 66. But never say never, we have 10% of the patient diagnosed under age of 50. All right, so especially if I see a patient, African American, with anemia regardless the age, especially like 40 or above, I do multiple myeloma screening on those patients. Second symptoms they present with is bone pain. As I said, the protein goes and do some destruction on the bones. Usually affect the back and the chest, the front and the back. More common than you see it in extremities. Okay, so those patients, they complain of pain, usually in the back, in the front, and mostly happens during the daytime when the patient are moving. At night, when they're resting, unless they turn the position, they don't feel the pain. So also as physician, especially primary care physician or hospitalist doctor, they need to have high suspicion of index if the patient comes with pain in the bones, unexplained. They need to do at least a screening for multiple myeloma. Again, you can see also kidney damage on those patients. So as the nephrologist here, Dr. Murray, I see tons of patients, she referred them to me because whenever she see unexplained kidney deterioration, also she do multiple myeloma workup on those patients. We have other symptoms the patient can present with. Those are uncommon, such as sometimes they get like tingling, numbness, anything affect the nerves. Sometimes also the plasma cells migrate outside the bone marrow and they start to accumulate together to form like a mass. So this mass can, occur, or you can find it anywhere in the body. So around the spine area, for example, just in the last month, I've seen 2 patients. They presented with a jaw mass. They were young patients. One of them was 50 years old. The second patient was 37. So she was fairly young, and she presented with a jaw mass. She went to maxillofacial surgeon, the face, and they did a biopsy of that mass, and it came back as plasma cell. So the patient was referred to me. So plasma cell or multiple myeloma, as I said, they can have unique presentation. Sometimes also it can be incidental finding, meaning that the patient goes to their primary care physician and they do routine workup, and they find out that the protein level in their blood is high. Our protein level usually around 6 to 8 or 6 to 9. If the primary care physician check their protein randomly, because that's part of the protein workup, and they find the protein level is around 13, that tells them there is abnormal protein circulating in the blood, and they have to do multiple myeloma screening. As I said, so it's usually a primary care or a hospital doctor duty to identify those patients with multiple myeloma. By the time they come to us, they are already diagnosed and we start the treatment on them. Okay, so again, it's a blood cancer. It's a common, more we see in African American, and it has a unique presentation. We have to high suspicion index. Not all cases present like what we see in the book. All right, so even as a patient, sometimes if you have concern, you can just bring it to your doctor and ask them, could it be like multiple myeloma, or do I need to do work on multiple myeloma? It's not gonna hurt to do the screening. The screening is very simple, and we're gonna talk about it in diagnosis, right? Thank you so much.
Thank you.